And now we're recording. You can still talk. It's okay. Don't be scared.
You want feedback?
Oh yeah, I want feedback, obviously. All right. So what we're going to talk about this morning is we're going to talk about the human body as a whole. And it's important to understand that, like I said, what we're doing here is we're doing what I refer to as building blocks. This is going to be really foundational. It's going to be what we're going to build off for the remainder of the time that we're in this class. So good notes, good information, proceed accordingly, if you will. And if y'all have questions, don't hesitate to stop me at any point in time, okay? All right. So in order to properly care for your patients, you have to have a working knowledge of the anatomy of the human body. That is a must. You have to understand, the knee bone and the thigh bone and the hip bone are connected, where things go, this, that, and the other, and why they're connected the way they're connected, or how they're interconnected, to be able to, see why one thing affects something else. That's very, very, very imperative. It also helps us when it comes to understanding pathophysiology, which is how things are interconnected. And it helps us to understand, like I said, the way that we need to better care for these patients. Okay? Yes. Okay, so we're going to talk about topographical anatomy. And we're talking about landmarks on the body. And what it does is it gives us a kind of roadmap, if you will, for the body. And I'll do a little bit of drawing on the board here so that y'all can see that as well. Where these landmarks go when it comes to the abdomen and things of that nature. Okay, this applies to the body, what's referred to as the anatomical position. This is somebody standing up, just like so, palms forward, just like this. It's what's called palmar position. Okay, all right. It's just how you see somebody lay down in an autopsy. They have them just like so. They'll be in the supine position, palms out. Okay, and that's what's referred to as palmar position. Okay. So here are the planes of the body. There are three different planes that we operate with. The first one is called the coronal plane, or the frontal plane. And what the coronal plane is, that differentiates front to back. Okay? Then we have what's referred to as the transverse plane. This is the axial plane, and that gives us top versus bottom. That is actually at the umbilical line. Okay? Natural umbilical, not like where your belly hangs. Okay? But true umbilical line. Okay? Because what that does is that, like I said, it differentiates the upper part of the body from the lower part of the body. And gives us a good, like how it separates our abdomen. And then, of course, there's the sagittal plane, which is left versus right. And this gives us our unilateral versus bilateral differentiation when it comes to parts of the body being affected. Okay? So those are your three: frontal, transverse, and sagittal. Okay? Coronal, transverse, and sagittal. Okay? Those are the ones you're going to want to remember. So our skeletal system, okay, when it comes to our skeletal system is made up of several different types of equipment. The whole purpose of the skeletal system is to provide structure and protection, okay? It provides structure, is what gives us our form, and it provides protection, especially for the vital organs, or the primary vital organs, okay? So we're talking heart, liver, lungs, brain, kidney, spleen, things of that nature, okay? Now, it's made up of bones, okay? It's made up of all of our bones. How many bones are there in the human body?
206.
206. All right, it's made up of ligaments, okay? It's made up of tendons, and it's made up of cartilage. And we're going to talk about what each of these does and how they interconnect here in just a little bit, okay? But there are 206 bones in the average human body. Some have more, some have less. And even naturally have more and have less. Okay. So our axial skeleton, which is the skeleton that forms everything from the arms, legs, the whole nine, okay? This is the skull, and your skull is made up of multiple bones. You have your spinal column, which is made up of 33 bones, broken down into 5 different sections. 7, 12, 5, 5, and 4. You're going to want to remember that. Your spine is broken down into 5 sections. 7, 12, 5, 5, and 4. and that's your total 33. Okay, and then of course your thoracic cavity, which is rib cage. All right, your rib cage, your clavicles, the actual scapula, the shoulders, the whole nine. Okay, that's what creates the thorax. So this is the skull. The cranium itself is 4 bones. Okay, the frontal, parietal, temporal, and the zygomatic, or excuse me, occipital. Those are the 4 bones that create your cranium. And the reason that those 4 bones are important is we always talk about babies, and we talk about the fact that babies have these fontanelles, these spaces in between the bones. The best way to think about it when you think about fontanelles is look at them like plates, the tectonic plates of the earth. As you grow, those plates begin to move together and fuse. Okay? Well, when those plates don't fuse together properly, what happens? Mountains form. Because they move together and either crest, or they move together and they valley. Well, in the average human skull, those form together and they fuse. That happens they begin around 2-3 years old. When those begin to fuse together, they start in infancy and continue until they're 2 or 3 years old. And about 5, they're completely fused. But the whole purpose is so that that skull can grow together like it's supposed to. Okay? But there's multiple different ones. Just like I said, if you look at the map of the U.S., you can see where all the tectonic plates are. That's where we have the major earthquakes and things of that nature, especially over Cali. Okay? And then there are 14 bones of the face, and those are all listed here. Okay? The major ones that we like to talk about are the zygomatic bones. Those are the bones of that form the cheek. The maxilla, which is the upper jaw. Okay? And then you have the mandible, which is the lower jaw. And if you look here to your right, you'll see one of the pictures talks about something called the foramen magnum. This is where the actual spinal cord and spinal column come down through the skull. Okay? And the word foramen means nothing but hole. Magnum obviously means large, so it's nothing but large hole. The reason that this is an important part of the skull to us is that is the only hole in the skull through which brain matter or fluid or cerebral spinal fluid will pass through. Now, because that's a thing, if there's any swelling in that cranial vault, and we'll talk about this more when we get to trauma, but if there's any swelling in that cranial vault, that's where we get the term herniation from. That swelling causes the brain fluid or cerebral spinal fluid to push down through that hole. And when herniation takes place, it pushes the brain and actually displaces it. And any displacement in that brain or pressure against that brain will cause your primal body functions, which all happen back here, to cease or to be severely disrupted. Okay? So that's a huge, huge, huge to-do when it comes to your patient. Okay? The temporal bones are the one that protect the temporal arteries and the nerves that run right here along the sides of the brain, as well as they protect your speech centers. Okay? This is your spinal column. Okay? The spinal column, we're talking about vertebrae. There are 33 vertebrae, and then each vertebrae has what's called an intravertebral disc. These are the spongy, hostess cakes in between each vertebrae. The cervical vertebrae has 7 vertebrae. Okay? There's 7 vertebrae inside of that C-spine. Okay? This is the most important section. This is why we use C-collars. This is why we hold C-spine, the whole 9. That's the section we're most worried about. Because in the area of C1, C2, that's what's called the atlas and axis. That's what holds the skull in place. C3, 4, and 5, if those are affected because of trauma, can actually cause you to not be able to breathe on your own, specifically C4 and C5. Those are the nerves that cause the diaphragm to work. So if those nerves are affected because of pinching, compression, what have you, your diaphragm may not work. You can end up on a ventilator permanently. So that's why somebody with a C5 fracture, a C4 fracture, that compresses that nerve will have to be, on a respirator. Okay, and possibly potentially permanently on a respirator. The thoracic spine makes up the posterior aspect of the rib cage, or beginning of the posterior aspect of the rib cage, or that's where it interconnects. Okay, And remember, there are 12 vertebrae inside the thoracic cavity, okay? And each one of these vertebrae have a nerve that comes off of them. And those nerves, how they pass through the body, is something called a dermatome. D-E-R-M-A-T-O-M-E. Okay? And it's a nerve map, if you will. Okay? And that nerve map, you'd be shocked where some of those nerves connect to and how they affect. Okay? I can tell you personally, I've got lumbar injury, and my lumbar injury affects everything from the middle of my back all the way around into the center of my actual groin. Like, you feel numbness, you'll feel tingling, the whole nine, and you don't even realize how much those things can affect you, where something in your back can affect something in your stomach, or something in your groin, or something in your lower leg, or cause numbness and tingling like sciatic nerve pain, things like that. But the lumbar and this is the most commonly injured section of the back. Why? Bending and lifting injuries. So you may want to know that. You may see that. The lumbar is the most commonly injured area outside of motor vehicles at collisions. The lumbar spine is the most commonly injured area of the back. And there's 5 lumbar vertebrae. Okay? There are 5 lumbar vertebrae. Then, of course, we have the sacrum and the coccyx. The sacrum is 5 vertebrae that are all fused together. Okay? There are 5 vertebrae that are all fused together, and what this forms is the posterior or back portion of your actual pelvis. It's what actually holds the pelvis together. Okay? Then you have the coccygeal vertebrae, and those are 4 of those. So there's your 7, 12, 5, 5, and 4. Okay, remember that number, 33. You're going to see that again. The brain stem itself runs directly down the center of that spinal cord, or spinal column. In a baby, it runs all the way down, infant up to 1 year, it runs all the way down to the actual terminal end almost of the coccyx. In an adult, okay, and every adult is a little bit different, it runs from the brain itself all the way down to the area of T12 to L2. That's where it ends in an adult. Okay? And this is why if you look at these nerves here in an adult, there's what's called a nerve bundle or a plexus, P-E-L-X-U-S, that runs out of here because all those tie in together. So if you have an injury anywhere between L1 and L5 as an adult, all of them are going to be affected by it. Okay? It makes a big difference. Any questions about any of that? No? So this is your thorax. This is, of course, formed by the 12 vertebrae of the thorax that come off of the actual spinal column. There's also 12 pair of ribs. Now, we have 10 what's referred to as true ribs, or excuse me, we have 7 true ribs. We have 3 false ribs, and then you have the 2 that are partial ribs that are in the rear. 11 and 12 only wrap around enough to cover the kidneys. Okay? You can see those there. Everything up to 7 goes all the way up into the sternum itself, which the body, the manubrium, and the sternal notch are there, and of course the thyroid process. The little, end of the spider there at the end. 8, 9, and 10 all come up and form into rib number 7. Okay, this is what part of the body is right there, where those form that arch. It's below the lungs, above the abdomen, and what's there?
Liver.
What's that?
The liver.
The liver, and most importantly, the thing that helps us breathe, the diaphragm. Okay, this is the actual arch that protects the diaphragm, and the liver sits behind there. In truth, in any adult, you should not be able to palpate the liver. If you can palpate the liver in an adult, they have a very, very severely enlarged liver. Okay, and that's a big problem. So this is what is referred to as your costal arch. And in between each of these ribs is what's referred to as the intercostal space. Okay? I-N-T-E-R, costal space. Okay? Understand that there is a nerve and an artery and a vein that runs underneath, above, and behind each one of these. Okay? So it's very, very important to understand. That's why you'll have people that, in a car accident, things of that nature, can bruise very easily. Well, if they break a rib, the problem with breaking a rib, you have several. Lung punctures, breaking of the, or tearing of the artery or vein, and of course, the nerve that runs right behind it is going to be extremely sensitive. That's why when you take a deep breath and, you take a hit to the lungs, this, that, and the other, it hurts so much because that's pressing right there against those nerves. Super sensitive. Okay? And that's a good thing because that tells us when something in that area is wrong. Side note, the most commonly, up here at the top, you see here, these are your clavicles. Okay? Those two that spread off there to the shoulders are known as the clavicle. This is the most commonly broken bone in a car accident. Why would you think?
Seatbelt.
Seatbelt. When that seatbelt pretensioner pulls, yanks on that clavicle, pulls you backwards. If you keep moving forward, that's a very small, thin bone that's going to snap. Okay? Alright? So inside that thoracic cavity are the heart, the lungs, the esophagus, the trachea, and of course, the greater vessels. And when we talk about the greater vessels, I'm going to give you a list of them. They're the inferior and superior vena cava. These are what bring blood back to the heart. You have the aorta, okay, which takes blood from the heart to oxygenated blood from the heart to the body. Okay? You have the subclavian arteries, subclavian veins. Those are what feed the blood to and from the arms. And then of course you have your carotid arteries and jugular veins. Carotid arteries take blood from the heart, from the aortic arch to the brain, and the jugular veins bring it back to the heart via the superior vena cava. So those vessels control all the blood flow going to and fro in the body. Okay? Everything going back and forth to the heart. So super important that this structure stay intact. Okay? These are the three pieces of your sternum. The manubrium, the body, and the xiphoid process. Okay? The purpose of these, like I said, is protection of that heart. And you'll notice these blue sections here, inside the body, the bone itself is actually a little more yellow, and these sections are like an off-white, like mother of pearl. What these are is what are referred to as costal cartilage. Okay? They are not bone. They literally run from the sternum to about the nipple line on either side down all 10 ribs. All 10 true ribs. Okay? The reason for that is, in the instance of you performing CPR, this is the bone breaking that you hear. What you actually are doing is separating the sternum from the costal cartilage. The cartilage breaks. The thing with cartilage is no different than cartilage in your ear, cartilage in your knee, anywhere else, that cartilage can be regenerated. Okay? Bone, to some degree, can, but not quite like cartilage can. Okay? So that cartilage regenerates, and what they typically do is, after you perform CPR on somebody, get them back, they wire it back together, and then it grows back together. Okay? So that's what it's supposed to do. Alright? Not so much in older people, but that's the way it's supposed to work. Okay? Then we have what's called our appendicular skeleton. Now the appendicular skeleton is all of our pivot points. Okay? This is our arms, our legs, their connecting points that allow us to be able to move, and of course our pelvis. Our pelvis is really and truly our biggest pivot point. The pelvic cradle holds the majority of the weight of the body. Okay? Most of our weight, about 2/3 of our weight, is actually all upper body if you think about it. And so because of that, the pelvis is a very, very super strong structure, and it holds up under immense amounts of pressure. Okay? It takes a significant force to fracture a pelvis. Significant force. Okay? We're talking 7,000 to 8,000 pounds per square inch to fracture a pelvis. It's a very, very significant force. but it happens.